Hello everyone, my name is Kevin and I am here representing Central Balance. I'm one of the acupuncturists working here along with other acupuncturists and herbalist professionals. So I'm going to do a talk today on chest pain. So firstly we'll be looking at the reasons for chest pain, both in Western medicine term and also in Chinese medicine perspective. So just 1 second, I'll just get everything ready. We'll get started. Okay. See if we can make this a bit higher. All right, that's better. The screen is a bit higher now. Great. Okay, so I'll start the talk now. Please, if you have any questions, don't hesitate to ask me, and I'll be more than happy to answer any questions. So, what is chest pain? Chest pain is one of the most common reasons that people visit the emergency room. Chest pain varies depending on the person. It also varies in quality, intensity, duration, and location. It may feel like a sharp stabbing pain or a dull ache, or it may be a sign of a serious heart-related problem or due to a common cause that isn't life-threatening. So what causes chest pain? When you have chest pain, you first thought maybe that you are having a heart attack. While chest pain is a well-established sign of a heart attack, it can also be caused by many other less serious conditions. According to one study, only 5.5% of all emergency room visits for chest pain results in a diagnosis of a serious heart-related problem. So heart-related cause of chest pain includes heart attack, obviously, which is a blockage of the blood flow to the heart. Angina, which is chest pain caused by blockage in the blood vessel leading to your heart. Pericarditis, which is an inflammation of the sac around the heart. Myocarditis, which is an inflammation of the heart muscle. Cardiomyopathy, which is a disease of the heart muscle. Aortic dissection, which is a rare condition involving a tear of the aorta, the large vessel that comes off the heart. Okay. Gastrointestinal causes of chest pain. So includes acid reflux or heartburn, especially after eating. Swallowing problems relating to disorder of the esophagus. Gallstones, which can lead to upper abdominal pain or pain after eating as well. Inflammation of the gallbladder or pancreas can also be the cause of your chest pain. Okay, so other than that, lung-related causes of chest pain includes pneumonia, which causes pain that may get worse with breathing. Viral bronchitis, which can cause soreness around your chest and muscle aches. Pneumothorax, which is a term meaning collapsed lung, causing a sudden onset of chest pain. A blood clot or pulmonary embolism, which can cause sharp pain that worsens with breathing. Bronchospasm, which causes chest tightness. So bronchospasm commonly occurs in people who have asthma and related disorder, such as chronic obstructive pulmonary disease, or also known as COPD. You can have muscle or bone-related causes of chest pain. So, which includes bruised or broken ribs, which may be due to any injury to your chest, sore muscles from exertion or chronic pain syndromes, compression fracture causing pressure on a nerve, and other causes such as shingles causing chest pain. You may develop pain along your back or chest before the shingle rash became apparent. Panic attack can also cause chest pain. So what symptoms may occur with chest pain? So if it's heart-related symptoms, while pain is, women in particular may report a typical symptom that are later identified as being the result of a heart condition. Okay? So you may also experience chest pressure or tightness along with your chest pain, back, jaw or arm pain, fatigue, lightheadedness, dizziness, shortness of breath, abdominal pain, nausea, pain during exertion. Other symptoms so are a sour or acidic taste in your mouth. So these other symptoms are not related to heart problems, okay? So pain that only occurs after you swallow or eat, difficulty swallowing, pain that's better or worse depending on your body position, pain that's worse when you breathe deeply or cough, pain accompanied by a rash, fever, aches, chills, runny nose, cough, feeling of panic or anxiety, hyperventilation, okay, or back pain that radiates to the front of your chest. Okay, so the above that I just talked about are the Western's reasons for chest pains and diagnosis. So accompany symptoms along with the chest pain. Okay, so some may be due to heart-related problems, others are musculoskeletal problems or caused by other organs. So let's have a look at the Chinese perspective of chest pain, the Chinese medicine's perspective on chest pain. So why do we get chest pain according chest pain or stifling sensation in the chest according to Chinese medicine? So again, anybody who experiences stifling or chest pain immediately thinks about, oh, it's related to the heart. But there are actually numerous reasons aside from the heart condition that can actually also cause chest pain. So such as lung disorder, stomach disorder, muscle damage or tear, shingles. They can all result in stifling sensation and pain in the chest area. Affect your chest, so and cause chest discomfort or chest pain. For example, the autonomic nervous system, if it's imbalanced, that can cause chest pain. If you're have high anxiety, stress, etc., can also causes pressure in your chest area and therefore ultimately resulting chest discomfort. Okay. So these, if it's psychological causes, oftentimes people visit the emergency room and they cannot find the cause because a lot of times it's psychological. Okay. And in Chinese medicine's perspective, we have the meridian system. So because the meridian system cannot be proven by the medical instruments that Western medicine uses. So even if you go to a hospital or to do X-ray or MRI, oftentimes they will not be able to identify the causes of your chest pain. Okay. So therefore, to really understand chest pain, we have to not only looking at the physical causes, but also the causes that we cannot see, such as the meridian system that I just talked about in Chinese medicine, or psychological causes also need to be considered. Okay. So for example, in Chinese medicine, we have the Hen 3 Yin meridians and Hen 3 Yang meridians. Okay. So the Hen 3 Yin meridians include our includes our lung, okay, lung, Tai Yin meridian, the Jue Yin pericardium, and the Shao Yin heart meridian. So these are the 3 Yin meridians. And then on the outside, we have the 3 Yang meridians. So you have your large intestine Yangling, large intestine channel. You have your Shao Yang, triple burner channel. And then you have your Tai Yang, small intestine channel on the yang side of your arm. This is the inner side, is which the sun cannot. From Chinese medicine's perspective, the pain in your chest often is associated with these meridians, because the reason being, these meridians, they travel along your arm, and then at the end actually ends up in your chest area or in the heart area. For example, the lung meridian travels up the side of your arm and then ends here and go into the lung, and then all the way down to the large intestine. And then the pericardium meridian, okay, also travels to the chest, Tanzong, and then down, okay. And then you have the heart meridian, travels on the inner side of the arm and then all the way into the heart area as well. So when these meridians are imbalanced or blocked, they can cause heartache or chest ache, okay? And the yang side meridian, the 3 yang meridians, okay? The large intestine, the sanjiao, the triple burner, and the small intestine, they all also travels to the heart or the chest area, okay? So this is why these are very important concepts. Otherwise, if you don't have these meridian concepts, it's very hard to determine what is the cause of your chest pain sometimes. If you're just looking at using the technology of Western medicine, you may not be able to find anything physical, even if you use X-ray or MRI to find something that is abnormal. Maybe you won't be able to see it, okay? So chest pain or stifling sensation or discomfort in the chest are often actually related to the change of seasons, especially when the seasons are at an extreme temperature. For example, stress to our body, and the channels can if they already have some problems, they cannot handle the extreme weathers, and therefore they will give out, or they will start to to have some symptoms develop, okay, like pain or discomfort. So it is often observed phenomenon that in the autumn period or in the winter period, the rate of heart attack or cardiovascular disease is 20% higher than ordinary times. Or in the summer when it's really, really hot, probably not so much in New Zealand, but in the subtropical or tropical countries on Earth, they have a higher percentage of cardiovascular or sudden death from cardiovascular causes due to cardiovascular diseases during the summertime when it's really, really hot. Okay, so that is also worth considering. So the symptoms that are associated with the three yin meridians can be categorized into sorry, let me start again. So the symptoms of chest pain can be categorized into yin meridian and yang meridian symptoms. Okay, so if you have problems in the yin meridian, the chest discomfort are more likely to be accompanied by these symptoms, such as hard breathing, breathing difficulty, stifling in the chest area, chest pain, angina, heart pain, yeah, and palpitation, speed up of the heart, cold hands and limbs, the sclera, the white bit part of your eyes are more yellow than usual, or jaundice, so that's called jaundice, I think. Diarrhea, harder breathing, like I mentioned before, speech problem, dry throat, fear of cold, numbness in the hands, and skin problems, tinnitus or ear problems, emotional and shoulder pain. So if it's caused by three ingredient, these are, you're more likely to see these symptoms I just mentioned. What if it's to do with the three yang meridian? So what are the associated symptoms with the three yang meridians? So oftentimes you'll be able to see neck pain. Maybe you're not sleeping properly at night, you have neck pain when you wake up in the morning. Stifling sensation in the chest, chest pain, teeth pain, okay, gum pain, or teeth pain, itchiness in the ear, what do you call hemorrhoids, dryness in the mouth, asthma or coughing, headache, abnormal skin appearances, bloating in the stomach area, hotness on your body, and puffiness in the face, hard of hearing, fullness, distension in the stomach area, throat ache, etc. Okay. So these are associated symptoms with the three yang meridians, okay? So let's talk about the treatment. How do you treat chest pain? So there are I'm going to teach you a few meridian points that you can use. And you can just massage it with your finger or with your thumb for a minute or two at a time and see if that can help you. And these are actually very well-known meridian points that can be very effective in helping you with your chest pain. So the first one is Let me take this off. So it's on the wrist, on the young side or the outside of your hand, the lateral side of your hand, to be precise. So it's on the wrist, on the crease, and right in the middle of your wrist. And this point is called yang shi, and you can massage this point, and it can help you loosen up any problems in your chest area that's related to the heart. Okay. Okay. And then the next point for you to massage is called 外关, which is about 3 fingers width from in between the 2 bones. And you can, when you press down, you can feel there's a depression there. And you just give that a rub. You can either use your finger or you can use some massage tool that's blunt, not too sharp. You don't want to puncture the skin. And the next point is 内关. Okay, so around 3 fingers width on the inside of your hand. So about 3 fingers width, your own fingers, and in the middle of the 2 tendons. There should be 2 tendons. You can feel there's 2 tendons running along here, and 3 fingers width, and you should feel a slight depression there. You can rub, give that a rub, and that's supposed to help you with your chest pain or heart, or any pain that's related to the heart. And then there's another point called 尺泽. 尺泽 is related, is located actually on your wrist. Okay, so you can, I need to roll up my sleeve so you can see. So when you bend your arm inwards, you can feel there's a tendon here in the middle. So actually, 尺泽 is located on the outside of the tendon, so on the lateral side of the tendon. So you can also feel there's a depression there. Just give that a press and a rub for about 30 seconds to a minute, and you should be able to, that should help you alleviate any problems to do with the lungs. Okay? And then there's another point which you can massage by yourself. This area is called 中府. 中府 is, if you can feel your clavicle here, so your clavicle bone is the top of your chest here, just right under your clavicle, if you trace along the clavicle, you come to a depression area. You can feel it, you can actually press quite deep. And this depression area is actually located between the clavicle and the arm bone. So it's sort of on the lateral side of the clavicle bone towards the arm. Okay. So this area, this point, just maybe 1 centimeter below is 中府. And that is the starting point of lung meridian. So you can give that a rub, and it can help you with any lung issues as well. And the point I just mentioned so it's also very good for your lungs as well. Okay, so give that a rub. So that's it for today, and I hope you enjoyed the talk, and hopefully it gave you more understanding of what your chest pain might be all about. Maybe it's serious, or maybe it's not, or it's related to heart, or it's related to lung. I hope you have a better understanding. And if you have any more questions, please give us a call on the address. So I've attached the number with the video. So give us a call. Center of Balance. We're located in Dinsdale, Hamilton, and look forward to hearing from you. Bye.